This patient encounter really demonstrated to me the importance of always maintaining a mindfulness of cultural differences. This applies to the manner in which the patients are approached by physicians, the type of questions asked, as well as how they are asked, the responses to their answers, and maybe most importantly, trying to understand the context in which these patient interactions fit into their lives, and not necessarily our own.
I quickly realized how the people of this culture are forced to live.
Much of holistic healing is about cultural awareness in oneself and in the patient, in addition to a mastery of medical knowledge and key concepts of a given diagnostic approach.
Proper diagnosis and, more importantly, the ability to effectively communicate the need to seek further care are paramount. With the help of our missionary translator, I feel our team was able to help the patient understand the need to seek help.
On our last day of treating patients in Honduras, I had a 34-year-old patient present with abdominal pain for 1 year in duration with a mass and anorexia. The patient was alert and oriented and was able to follow all commands. He also presented with anxiety and diaphoresis. He stated that he had no family and had been curing his stomach pain and symptoms with jayito. I am a native Spanish speaker, but I was not familiar with this term. He appeared to be very thin, with a BMI well below the normal range. He looked much older than his age, and he appeared very weak and seemed to be in a depressive state. HEENT, lungs, and heart were all within normal limits, and his skin was moist and diaphoretic. Upon an abdominal exam, we felt a mass in his right upper quadrant below the area of his liver that almost felt like a small football. He had normal bowel sounds, and the mass was painless when palpated. When we asked if he had ever had this mass evaluated, he said no, because I'm cursed. Dr. Ciamara explained that jayito refers to a Honduran curse regarding pain in the abdominal area. According to Honduran culture, when a Honduran experiences abdominal pains, he is seen as being cursed and is not to eat for 2 or 3 days, or until the symptoms subside. If the symptoms diminish within a few days, the patient is cured and can resume eating. However, if the symptoms last for more than a few days, the patient is deemed cursed and remains in a state of self-deprivation. We diagnosed this man with an RUQ abdominal mass of unknown origin, anorexia, and malnutrition. Dr. Ciamara believed the mass to be cancerous. However, the patient refused to believe the mass was anything other than a curse. After all, this was his culture. I really didn't know what else I could do for this patient. I tried to explain the physiological basis behind his stomach pains and his GI symptoms, but he continued to believe it was only caused by the curse. Dr. Bolin suggested that we approach this case with cultural perspective. We should lift the curse. So we contacted the minister from the church we were using as the waiting room. Fellow VCOM students and some other locals gathered in a circle and offered prayer for this man. He was very grateful for our prayers and our lifting of his curse. He had a smile on his face as he left the clinic. He gave me a big hug as he walked out, and I realized that we truly had helped him through more than just multivitamins and a hospital referral, both of which he probably won't use. In a culture in which I'm not completely familiar, it is important to understand the way the people view disease and treatment and to integrate their beliefs with the way I view disease and treatment. With this particular patient encounter, I realized there is more to being a physician than just running tests, finding a diagnosis, and prescribing medicines. If we listen and look for alternative methods, we can truly come up with ways to treat anything. If we can make this man believe his curse is lifted, then maybe he will be more active in getting better and following through with his treatment.